Welcome back to the Mental Health Reform Podcast, where we explore the stories, systems, and social changes shaping mental health in Ireland. Today, we're talking about something that sits at the very heart of addiction recovery, and yet too often goes unspoken: stigma. Stigma isn't just a word, it can be a wall that isolates people, blocks access to care, and keeps too many trapped in cycles of silence and suffering. Sometimes people build these prisons, but we often build them ourselves, brick by brick. Merchants Quay Ireland has recently completed compelling research on public attitudes towards addiction in Ireland today. And joining me to unpack these findings is Dr. Rhonda Barron, Deputy Head of Research at MQI. Rhonda, thank you so much for being here. Really appreciate it.
Hi, Steve. Thanks so much for having me along today.
Before we get into the findings, could you maybe give us a quick snapshot of Merchants Quay Ireland for anybody who may not be familiar?
Sure. So Merchants Quay Ireland is a very uniquely placed organisation and has been at the forefront of supporting those either experiencing homelessness or addiction for a significant period of time. The organisation has its roots with the Franciscans in Dublin, so we're going back centuries. But the organisation really became a charitable organisation back in 1991, and it was kind of shortly following that the first needle exchange programme in Ireland was set up. The current Merchants Quay was really kind of re-established and formed in 2012. So we have services across the country and different types of services. Our head office and our open access service is based in Riverbank, here in Merchants Quay in Dublin. And we also provide services around the East Coast. We have our detox facility, we have our rehabilitation facilities, and we also have facilities in the Midlands. Merchants Quay also provides counselling services alongside with the Irish prison system.
Great, thanks very much, Rhonda. Maybe we could jump into the survey that was published over the summer. The 2025 survey shows that while perceptions are improving, many still view people with drug dependency as possibly dangerous or blameworthy. My question for you is, how deeply does stigma run in Irish culture when it comes to addiction?
Yeah, so this is a really great question, Steve, because if we think about the survey results in our own survey there that we published in July of 2025, it really did show that there has been important shifts that have happened. There's much more compassionate views, particularly over that 25-year period. But there are still substantial pockets of blame, there are substantial pockets of fear, and they remain. And that feeds into both public stigma as well as personal stigma. And if we think about stigma, and particularly shame, it's cultural in one sense because it feeds into social expectations. And those social expectations, they can be about choices that people make. It can also be about a morality or a moral viewpoint that society may have towards addiction or homelessness in of itself. We also have then structural challenges that feed into shame, and that can come from things like punitive policy histories and criminalisation towards individuals who use drugs. But there's also that interpersonal section as well. So it could be family or friends or members within your own community and how they react to addiction. So when you have a mixture which is quite complex, and we're also seeing then that growing public sympathy, it's very much in principle, but we're still seeing that persistent blame and fear. And that creates a very powerful level of shame then for people who do use drugs. So we've got the social, we've got the structural. It's not just an individual feeling. So are that kind of thing like the language that we use, how we describe people who are drug dependent or people who use drugs, that can be extremely damaging and lead to further internalization of shame. So criminalization narratives and community kind of reactions, we see that individuals become marked in a sense. So they're part of an other. And that really leads again back into an individual's own sense of identity. And we all have multiple types of identity, from I'm a researcher, I'm a parent, I'm a woman, I'm a member of a community. But this leads into a very negative, attitude or a negative identity that society holds and that an individual can then begin to internalize. And that leads then into very difficult circumstances. So you can have isolation And we know from the evidence base that we see less treatment uptake, we see worse health outcomes, we see parasocial, so connection within the community starts to erode, connection with family members start to erode, and friends, education can become impacted. So MQI takes several different approaches to try and dismantle stigma, dismantle shame. And I think fundamentally, I suppose at the kind of like starting point, the way that our services are designed and delivered. So a lot of our services are low threshold. That means that you do not have to go through a complicated referral process. You can often turn up to those, and we have a very simple process to then engage with the services. So it plays a really vital role in trying to normalize help seeking. We also have very much the kind of ethos of non-judgmental interactions. And that links into, of course, things like trauma-informed language, person-first language, non-stigmatizing language, which is probably one of the most simple and yet powerful steps to start to change some of that language, reframe language, move away from terms where people may feel criminalized to feeling as a person who has a health need. But we offer, again, a lot of those different services from the detox, our residential programs, our rehabilitation program, aftercare programs. We provide family support, public education. We're also engaging in research that is attempting to reframe addiction as a health issue. And our community engagement and outreach teams, they again play an incredibly vital role in accessing people who are often living on the most marginalized fringes of society. And these are individuals who often will not access the service that's available. So that community being able to, our community engagement team being able to go out and make contact with those individuals is absolutely crucial. But we also try to engage in other mechanisms. So if we think about visible contact-based public education, so we work quite well with and quite a lot with people who use our services, and we engage in storytelling. So that's people with lived or living experience, people who are in recovery, sharing their real experiences. And these, again, are a really strong evidence-based way to be able to reduce public stigma. But those low threshold, non-judgmental access points of the drop-in centres, our needle exchange programs, they reduce then that gatekeeping, which signals judgment. And that's really essentially, you know, I always kind of describe it as a bit of a foot in the door. It offers people a moment outside of, and it's a safe environment where people can actually sit and have a moment. It's non-threatening, it's safe, and it allows people to have that connection with somebody who understands, somebody who's willing to listen, and somebody who's willing to provide help. The other kind of element as well is really about communities. I always kind of say that people, we don't live in silos. Yeah, we live in very complicated kind of like ecological systems. You know, we have businesses, we have families within communities and education. So engagement with our local communities is absolutely vital. And it's about pairing the evidence of things like, well, why does harm reduction work, alongside local kind of dialogues, so that our services are not a surprise to individuals. And that can then reduce down, I suppose, the uncertainty that a lot of people have. Community kind of work and community engagement and open dialogue with communities is absolutely vital. And it's complicated, you know. Dismantling shame it's a two-track kind of system. You know, we have to change the story that we tell about people, but we also need to change the way that services are delivered so that people actually feel safe to use them.
It may be a simple thing, but maybe you could clarify for me and the listeners, is this idea of public stigma versus private stigma or internalized stigma. Could you tell me a little bit more about that and how they interact with each other?
Yeah, so stigma is quite complex. So if we think about stigma essentially are negative attitudes that often would kind of result in stereotyping of either individuals or groups of individuals. So at a social level, we may have a stigmatizing view. For example, all people who use drugs are criminals. Um, and if that narrative is one that's kind of produced, and people start to hear that in themselves as an individual who may use drugs, they may start to internalize that. And this is it, like, when we think about internalized stigma, we know that it leads to so many poor outcomes. You have poor treatment engagement for individuals who have lower self-efficacy, worse mental health outcomes. So that kind of those kind of interventions, and they have to address both the practical access and the belief systems about worthiness. And that's one of the things, when we think about the idea of our low threshold access and harm reduction services, by reducing down kind of procedural hurdles. So we don't have onerous intake steps. You have your healthcare on site. It reduces the "I don't deserve help" rationale that so many individuals have taken on board. And it's about giving, practical dignity restoring support. And that could be help with housing, help with access to benefits and healthcare. Um, and it's the very small practical wins, and they are small wins quite often, that can reduce shame. It restores social roles, and it helps to restore agency for an individual as well. And it's really quite interesting. Like one of the clients who actually use our services, she's a young woman, she's in her 30s, and she very generously shared her story, her testimonial with us. Her name is Amber. And Amber's story is one where she, as a young individual, escaped from her own community, ran away, and came to Dublin. And she had escaped away from a very, very abusive family situation, and unfortunately found herself in very similar circumstances here in Dublin. And one of the things that Amber talks about in her experience of living in Dublin often is the kind of like the hiding aspect, and how, again, that internalizes the message around people who use drugs. She speaks around how she spends hours every day, not even using, but just traveling to areas like train stations, shopping centres. And she talks about this, that she's hiding from, and she's being hounded by society, and that the shame that she feels actually pushes her further down into the hole of addiction. And another point in Amber's story, she talks around that point. We can't be hounded and persecuted out of being addicts. So in fact, the more miserable people make their lives, the more you push us into the seeking of solace that is in addiction. And that message becomes very, very much internalized. So, she speaks very heavily around how things can go very, very quickly go wrong with your health when you're in an unsafe and an unsanitary environment where people react towards you with disgust. And then how that message becomes internalized. So you think that you're scum, you feel that you're vermin. And they're Amber's words: you think you're scum, you feel that you're vermin. So the language, that we use, the way that we can react, can be extremely damaging. And over time, those messages become very, very highly internalized.
And thank you for sharing Amber's story. It's definitely like some potent imagery that comes to mind. And for me, when I picture that, I can imagine like people being pushed further below, but also to the sides, like being marginalized, literally marginalized to the edge of society. And it can be sometimes so much easier for us to other people in difficulty rather than face the truth that by doing nothing, we are actually complicit in their addiction. And as a society, we don't like to look at that mirror where we're failing, like certain cohorts. So it's much easier to push people aside rather than look internally.
And she talks about the use of the medically supervised injection facility at Merchants Quay, and how it has, and I'll read this verbatim: the MSIF offers me the space to evaluate a bit, maybe start thinking about reducing. I'm doing that at the moment, going through the process of what can I do to maybe change things and make steps forward. I really hope and expect it will be like that for a lot more people. I'm not saying I will instantly become drug free. I won't. I'm in too deep. But it will give me space to think, plan ahead, and maybe cut down. I can't even explain what all this means to me. There aren't really words for it. The difference of having the most intensely stigmatized, shameful thing to be accepted. It's new, it's revolutionary. And I just felt like that this was such an incredibly powerful example. And it's that kind of, I suppose, Steve, it's like we said about those small steps. Quite often, the change doesn't happen overnight. It takes a lot of building of trust, building relationships with individuals. And it's that offering of a safe place that often just gives people a moment out of the chaos or out of the constantly trying to hide and conceal that is happening outside of, the services, that they can actually take that time to reflect.
I understand that Merchants Quay Ireland has called on the government for a national campaign to end stigma. Could you be able to tell me a little bit more about that?
Absolutely. And this was part of our pre-budget submission that we made this year. So I think one of the really interesting kind of aspects of this, of the research and the findings, is whilst we have seen significant changes, there's a lot of room there to do more. There have been campaigns in the past. I think the last campaign that was run was back in 2018. But to have a much more formalized, really strongly invested campaign, which, places the heart of, I suppose, lived experience added to, is vitally important. And that kind of like reduces down, I suppose, one stigma, but we can do that through awareness, education, and again, that contact. And it's we've kind of seen that, I think it was quite a large increase. So 2/3 of the individuals who took part in that survey, so that was over 1,000 people, actually either know or have known somebody. So it was a 50% increase from 20% to 52% of people who either know or know somebody who has either had or currently has used drugs. And that's quite a startling figure. And I suppose it's representative of what we know and what we see, particularly in the data. But the stigma around that has to be tackled from a multiple focal point. For those who don't have the knowledge, haven't come into contact, or may simply be kind of like asking themselves, like, well, what is it that I can do? What are the small changes that I can make myself as an individual that might make a difference? But one of the strongest ways that we can change that stigma, again, is through one, education, and two, having that connection. So seeing people who are in addiction as real people.
What could be a small thing that a listener could take away from today that they could maybe look at the world a little more differently?
Yeah, I think the biggest small change that we can do is maybe think about what kind of language that we use, maybe challenge yourself a little bit more around that. And that can be quite challenging in of itself, because language is social, but it does evolve over time, and it does affect how people perceived or perceive themselves. So kind of just having that little bit of extra consideration, maybe around the type of language that we might use when we are talking about, addiction. I think that will be a really powerful first step.
What would you say to those listening who may be experiencing drug dependency themselves or know somebody close in this situation, but afraid to speak up out of fear of stigma?
I suppose it's about looking at what are the resources that are available to you. And sometimes it might be about getting the right information. It might be about speaking to, a confidant, so somebody who is quite close to you. But fundamentally, the kind of roads to kind of there to to kind of get that information would be to use services like Merchants Key Ireland, your GP services, so that you can, I suppose, access the right referral pathway that's needed for you, because we may be looking at people who might have very different levels of need here. Because stigma is the biggest barrier to recovery, and the more that we replace judgment with humanity, the more doors that we open for individuals, for families, and for Ireland as a whole.
Thank you so much. I think that's a very powerful note to end on, Rhonda. I'd just like to thank you so much for your insight and work.
Thank you very much for having me today, Steve.
And for anybody listening who wants to learn more or support Merchants Key Ireland, you can visit their website at mqi.ie. And if anything from today's conversation has brought up something for you, remember, help is available. You could contact drugs.ie, the HSE Drug and Alcohol Helpline at 1800 459 459, or speak to your local GP.